Check, 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 check. Check, check, check. 1 2 1 2. 2 1 2 1 2 1 2. Check, check, check. 1 2 1 2. 2 1 2. Yeah. It says a 20-second delay. Check.
Hello? Good to see you. Juror number 12. Hello, everyone. Great. God, what a beautiful crowd. My name is Dr. Cherie Poitier. I'm a regional medical director here in service planning areas 5 and 6, also known as West and South LA. And on behalf of the Public Health Department, we welcome you to the Martin Luther King Center for Public Health. So today is a celebration. I do have some notes that I want to refer to. Today is a celebration, and we're glad that you've taken time out of your day to join us. Before we get into the meat of the matter, I'd like to just give you a little background about public health. It's been said, oh, okay. The microphone, I don't. It's been said, if done correctly, the work of public health is largely invisible, and maybe a better way to look at that is that it's seamless. And the public health department interacts with public in three ways. We prevent and mitigate transmission of infectious diseases. We promote health by ensuring healthy outcomes. And we assess and try to intervene with health disparities. And in terms of health disparities, having the birth of a child is a wonderful event. But unfortunately, in not all populations,
My first introduction into the work was just going to a La Leche League meeting, if anyone knows what that is, 31 years ago in Brooklyn, New York, and just realizing I wasn't the only woman or the only mother sitting in her house just nursing all day. I walked into the group and there was like all these other people doing the same thing, and I was like, oh, it's not just me. There's other people that have babies and are nursing and all the things, and it really drew me in. So I blame my children for bringing me into this. Became a postpartum doula, eventually became a postpartum doula, and then eventually a birth doula. And my childbirth experiences were always led by midwives. I knew about the power of midwifery, and I wanted to, that's who I wanted to attend me at my births. And my first birth out of hospital was my second child, and I had a black midwife, and I mean, it was just such a magnificent experience. I said, I want to do this one day. I really want to do this one day. And it took me until most of my kids grew up to be able to devote the time and energy it takes to become a licensed midwife. And so I started that journey officially in 2015, enrolling in school. I graduated 2019 and was licensed in 2020, and shortly after opened a birth center. Thank you. But prior to becoming a midwife, I became a board certified lactation consultant. So I'm celebrating my 26th year, I think, of lactation consultant. Yeah, and
Can you hear me? Oh, okay, thank you. So all of you all that are here, you see that there are many various pathways to get and work here. I haven't shared with you. It's tacos and chicken that got me here. You go, what? I worked in the quick service restaurant industry, and I wasn't good at it. I got to find another job, okay? And then the Black in Health program started back in 1990, and I had the pleasure of being selected as the first BIH program manager in Los Angeles County at that time, and I'm still here. And it still got my heart. So again, you can come by way of a nursing pathway, an educational pathway. Motherhood will bring you here, and early education will bring you here to this spot to work with families, moms and babies. And I don't have one more question as it concerns your profession, and that is, I know you're all passionate about the work that you do, and you know how important it is to recruit the next generation of birth workers. So please tell the people, what's the most rewarding part about your work? Again, Maria, you got the seat, girl, go first.
I want to get like their insights and then put
I
mine
got
too.
two other questions, I'll come back.
I forgot the question.
That's okay. You're passionate about what you do now, Maria. You're passionate about
I'm a
what
little
you do.
concerned now.
Okay. Tell our audience, because we want to recruit them through the nursing way, what's the most rewarding part of the work you perform?
And supporting them to do this work, because it's not easy work, but it's definitely very rewarding to be able to be in a position where you're going out helping families do better, thrive, and Unfortunately, we'll have to get paid for it. So, but it's important. It's really important to engage and pass it forward. That's very rewarding.
Thank you.
So the center that I lead is new, and so we're able to be really entrepreneurial. We're able to be a little scrappy when it comes to solving problems for the center. And so the thing that I'm really excited about is that we're able to be creative about how we solve problems for one family, and then we're able to expand our programs to be able to solve that same problem for multiple families. So it's more accessible, we're able to pull in public and private funding to address it, and so really just being able to problem solve for the families in our community and kind of like build the data and get the money so we can do that for even more folks is what excites me.
I love the clapping after every one of our responses. It's very affirming. But, you know, when my business partner, sister midwife, Allegra Hill, and I decided that we needed to do something about what was happening in maternal child health for folks of color. It was 2017, and we had just attended a Midwife Alliance of North America conference in LA. And we were sickened, honestly, by the session after session talking about maternal mortality, talking about infant mortality, and of 4 care moms, 5 years at the most in our lifetime, at the very least. Please, we've got to end this. And so Allegra and I sat down together at the last, we were totally disgusted, and we decided that we had enough experience between the two of us that we could do something. And one of the things that was really important to us was training, providing opportunities for folks of color who wanted to get into birth work to have an opportunity to do so. So we created our nonprofit organization, Birthing People Foundation, and we started raising money to provide scholarships for folks of color to become birth workers, whatever that looks like, whether that's a lactation consultant, doulas, midwives, mental health professionals, the whole gamut. And we did our first training. We scholarshiped everyone. And we also wanted to make sure that the training was taught by Black and brown and marginalized professionals from marginalized communities, as opposed to this idea that anybody who wanted to be a doula had to go through a white organization such as DONA to become a doula. We knew that they didn't speak to us. We knew that they didn't speak for our community, and that they weren't understanding or addressing the issues that we had in our own communities. And so it was really important that we had a for us, by us training, or by us, for us, all the things, both ways. For us, by us, for us training. And, the way Spirit works for me is that you get kind of like these messages and these pushes to do things. And then shortly after we trained our first cohort, the Department of Health we heard through the grapevine, Department of Health is wanting to bring doulas in and things of that nature. So I was able to kind of go to some of the roundtable discussions that were happening. I think that's the first time I met Adjua. Do you remember? Were you there? I don't know. I think. Maybe. She probably was there. Yeah. And we sat at... I think maybe, yeah, the first one. And I'm like one of those people that like, I wouldn't consider myself a follower. And I just came in and I was like, this is what we need to do. And they were asking at that point, like, should we hire Donna to train the AIM doulas? I was like, oh, hell no. Like literally, I was like, no. Huh? No, I heard through the grapevine. So anyway, I was like, man, I need to come to these meetings every month because they're going to get Donna up in here and this ain't going to work. So I was able to let the folks know that, we were developing something and we already had something going, and we would like to, be of support. And so alignment happens, I think, when you're listening to your inner guidance, your higher guidance, and then the opportunities are there. So I was able to work with the Department of Health people. Eventually, we were able to bid for a contract to train the first two trainings for AIM doulas. Also, what was really fantastic and wonderful was that we had already trained Black and brown doulas. And so when the AIM program was ready to hire, which was before their own training that we got to help them with, we had doulas trained and ready to go. And I think out of the 12 doulas that AIM hired, I think 8 of them came from the cohort, one of our first and second cohorts that we did. So I'm saying all this because I failed to mention that I recently took a position with the Department of Health mentoring the doulas, which is so awesome. I just love being on call for them. And I love receiving their calls at 2 a.m. or 3 a.m. They know that someone is there that's going to answer the phone. I mean, I'm up anyway. I mean, my phone's on anyway. So, retired doula and doula trainer and all those things is really to pass this down to my goal is to create a legacy. Midwifery is a traditional passed down knowledge type of thing, as well as doula. And I'm here so that I can retire one day. I'm here helping out the next generation as best as I can to be as powerful, more powerful, and have, the best impact and the greatest impact they can have for the community.
And so what brings me excitement is that, so when I started with Black Infant Health last year, we were, of course, still in the pandemic, and our program specifically had suffered from turnover. But when I came into those doors, I came amongst a group of passionate women who really wanted to do our program, to make it thrive, and to really connect us having a low staff. That had a passion, but were also skilled and had like doula background, lactation experience. And I find that to be very important because we do have our group cohorts, and it's such a great way for our mothers to learn direct someone skilled at providing a doula support service or providing breastfeeding support, to have that conversation with someone who's actually experiencing it and who's trained in it. So my goal is to really, I've written grants in the past, and so I want to be able to write a grant so where I could provide any of my staff with free doula training, where they can become doulas, even myself, because I am fairly new to the Black infant health, maternal health field, even though I have a child care background. And so I just think the
Patient, open doors, them being welcomed and seeing as an extension of the care team into the community will be important for the birthing process.
Thank you. And Maria, come
See,
on, Maria.
it's better
Bring us
at
home.
the end.
Bring us
So for us in our program, we have these facilitators and how we educate the community. I think education is really important in preparing mothers. What we have this facilitator called patterns and expectations, and we know we do better when we know what's going to happen,
Right.
what to expect when we're in the hospital, when we're in, how to prepare for this event. So I think that education and having people to go out there in the community and meet these mothers and teach them about what to expect, kind of like the book, What to Expect When You're Expecting, but through our one-on-one education. It makes things a lot better. It makes it, for them to be able to advocate for themselves once they're in situations that may not be what they expected.
Thank you so very much. We're not going to get to the last question, so you guys are almost free to go. I just want to close out this panel. Could you give them a round of applause, please? For sharing all their information as well. Just sit tight. I started with a quote, and I'm going to end with a quote by Tina Turner. By honoring each other's ethnic, religious, and cultural backgrounds, we become stronger and happier, brightening the cosmic masterpiece of artwork that is our world. Rather than emphasize differences, we should be looking for similarities. Our differences are ultimately superficial, and the best thing to do is celebrate them. Happy birthday. Adjua Jones. Adjua Jones to the front. Adjua Jones.
Everyone, thank you to our panel. Another round of applause, please. And as I invite Adjua Jones up, and as well as the families that will be sharing today. And that was perfect. Thank you, Yo, for your facilitation and also for getting me hungry talking about cake. And your quote was really perfect. I was thinking about another birthday tradition that I had growing up. You know, I grew up in a household where it was black folks, Filipino folks, and Mexican folks, and that was my family upbringing. So our birthdays were filled with gumbo tamales, lumpia, pancit. Oh my gosh, right? How beautiful and wonderful that was to have as a birthday experience. So I invite the families up, please, our next panel. Thank you. Woot woot. I need to hear a woot woot. Our baby's in the house. Oh my goodness. Oh my goodness. See, this is what we live and work for. Adjoa is Director of Community Engagement and Outreach for the African American Infant and Maternal Mortality Prevention Initiative. She is also just all the things. A longtime South LA resident, born and raised, and someone who pours her heart out, as well as many folks in our work on behalf of families and babies. Look at how amazing. So I would like to turn it over to Adjoa.
You know, it's nothing like great directors. So I want to first give a lot of thanks to Dr. Ferrer, our public health director, who first initiated the conversation. Me being in public health these 30 years, I know I look real good. Most people don't realize I'm this young yet. But I am in the Century Club. I call it the Century Club. So I've gratefully made 52. But I want to thank her because she was the first public health leader that I heard in LA County say that racism was one of the leading causes of African American infant mortality, and which led and put the impetus for us to be able to create this great work that has expanded, where we can look at birthday celebration for all. So I'm very grateful and thankful to you bringing Dr. Allen aboard, who also brought Dr. Franklin aboard. But my colleague Yolanda and I go back, being in the first Black Infant Health Program. That's where I got my start, was BIH back in the 90s when I was in college. So I'm super excited to see what we have here. I'm super excited that we have expanded and grown so much in what we do that we don't even have room at the table. That's how good we are and what we're doing to support birthing families in our birthing community. Hey man, what's happening? Got us a little future Jordan jump. I'm super excited. Look at, okay, these beautiful babies. What are their names? David. Hi, David. Everybody say hey to David. Okay, and Nason. Everyone say hello to Nason. Okay, and this is what we do. This is what we're excited about. So what we're going to do today, and I'm going to make sure our program leads introduce their clients, introduce themselves and their clients. But we're going to talk about a couple of our programs, and you guys will have the opportunity to share with us how the program has been, if it has been beneficial to you and your family and your babies, and share with folks so that they know about this great work and be able to share. That's the purpose of a lot of our work that we're doing, especially with the AIM community action teams, is a partnership of community and government so that others begin to become aware of the services and resources that are out there in their community. So we don't have folks saying, well, no one comes to my services. So you get to see like Cinemoms, you get to see WIC, you get to see Black Maternal Health Center for Excellence, Help Me Grow, the Home Visitation Program, and all of the Shields for Family and all of the rich resources we have in our community, DHS Mamas, Black Infant Health. So we're super excited about this conversation that we're going to have. Who wants to get us started? Is my AIM doula program home visitation? You ready? Okay, well, introduce yourself and your beautiful client and her baby boy.
Yes, hi everyone. Thank you for having us here. So my name is Lisette. I'm a public health nurse with Nurse Family Partnership, and I'm so happy to introduce my client. This is Irma, and this is her 8-month-old baby boy. This is David.
It's on, right? Okay. Hello, everyone. My name is Ladina Jordan Simpson. I'm with the Shields for Families Parents and Teachers Home Visitation Program. And I'm happy to introduce LaDawn Taylor here and her 4-month-old baby, Nason.
Welcome, welcome.
Hi, I'm Lorna Leverett with the AIM Doula program, and I'm happy to introduce my client here, Elise Sladden, and her daughter is 9 days old. 9 days old.
Hey, woo! You out the house? Girl, you know, back in the day, we was like 6 weeks. We had to stay in that house. You couldn't come outside. God bless.
Hello, everybody. Can you guys hear me okay? Yeah. I'm outside the speaker. I'm Davion Malden, the fatherhood coordinator for the AIM team under PEI umbrella. And right here, today I'm going to be speaking on our Expecting Fathers group. And this is Dominique Sandifer, actually one of my close friends, and he was actually in our very, very first Expecting Fathers group. And his daughter actually turns 1 next week, the 15th.
Congratulations. We're excited about that. Okay, great. So, let's see here. We're going to talk about, you have to tell me how much time I have sometime. Give me a time check. Tell us about your program, how people can get involved, and kind of like a brief of how you support families, birthing families.
Okay, thank you. So once again, my name is Lisette, and I'm a public health nurse with Nurse Family Partnership. So we are a home visitation program, and we do follow an evidence-based model where we enroll our clients in the pregnancy phase. And typically this is before 28 weeks gestation, and so that just gives us plenty of time to really get to know our families, and they get to know us too. So our moms who get enrolled into our program they can be first-time moms, so first pregnancy, or moms who may already have children and are expecting another baby on the way. So typically, we are with our families until the baby that's enrolled reaches 2 years of age. So it's plenty of time to really get to know them, and they get to know us. So the type of support that we provide for our families and our clients are, really supporting them to have healthy pregnancies, and this can be through discussion of nutrition and exercise. We do take weights and blood pressure screenings throughout our pregnancy visits. And we're really focusing on things such as identifying danger signs of pregnancies. And so this is something like preeclampsia. So we want our clients to really know what to expect and what to do if this is something they're experiencing. We do cover all of the important tests in prenatal visits, vaccines that can be offered. As our little ones, as our moms then are, starting to notice baby movements, then we're focusing on counting those baby kicks and what to do if they're not experiencing them. Our moms are then, getting close to delivery, so we really want to have that discussion with them about what to expect for labor and delivery. So once our little ones are here, we are focused on that bonding that's happening with our mom, our baby, and dad and family as a unit. So this is also a really important time for us to provide breastfeeding support. And then we also do newborn assessments. We're talking about safe sleep, SIDS prevention, and as little ones are growing, lots of different topics such as introduction to solids. Injury prevention is a big one for us. So as soon as little ones are starting to roll and crawl, which we're getting there, we're definitely want our moms and our parents to be aware of those injuries that can happen in the home and outside of the home. We do several screenings with our little ones. We're doing developmental milestones. Our moms get screenings on anxiety, depression, and intimate partner violence, so we're able to refer them to services if needed. And so really important with our moms, I know that because we do spend a lot of time with them, we have that opportunity, and we try to focus on really trying to see what is our mom's heart's desire. And so we're focusing on goals. And sometimes those goals, we can provide a supportive role or linking them to services. And so as our little ones and getting closer to 2 years old, they do graduate from our program, but then we're able to transfer them to one of our partners with HFA or PAT.
Great, thank you. Thank you. Well, I'm going to skip down to Davion. We'll come back. Tell us about your program, how you support families.
All right. All right. So our program that we're talking about today is our Expecting Fathers group. The Expecting Fathers group is more curriculum based. It's a 5-week group. They come in at 5-week cohorts. We do it every Tuesday when they're with us. And the purpose of the program is to empower fathers on how to become better advocates for their partners, better advocates for their babies during their pregnancy, labor and delivery, and into the postpartum periods. And also to empower fathers to be able to step forward and be side-by-side parents with their partner, as opposed to feeling like they have to be in the background and be an ancillary parent. We go over details of how to be there and be supportive during the pregnancy period. So being during the prenatal appointments, making sure that our partner has a safe, clear, safe environment, being stress-free, making sure that they understand everything that's going on with our partner is passing along to our baby. So we want to make sure that we're putting our partner in the best environment possible. Then we go on to details of what it looks like to go through labor and delivery, heading into labor, talking about contractions and things like that. When we get into the hospital, how to interact with the medical staff, how to be an advocate, how to be side by side with your partner, but then also understanding when it's time to take a step back and let the medical professionals do their job, how to ask questions to fill in those gaps where there's things going on where you don't understand what's going on, how to ask those questions, how to be respectful asking those questions, and also how to step in and understand that we may have a birth plan, but we may have to divert away from that birth plan and asking questions why and what are possible outcomes of that. Next, we go into postpartum and what that time frame actually is. Us within the AIM network, we look at postpartum as that entire first year of life for the baby, not just the first 6 weeks of life. So we have to push on that understanding and helping the fathers understand their importance and them being proactive and how that can swing the demographics of these numbers where black women and black babies are dying during childbirth and then labor and delivery and then postpartum, and how our presence there can help swing those numbers back towards the positive side. Then we go into postpartum, taking care of the baby at home. So we're talking about everything from diapering, swaddling the baby, safe sleeping practices, breastfeeding support, feeding the babies ourselves. And then from there, we go into mental health check-ins and making sure that our fathers feeling like they're adequately prepared, prepared to go into the hospital, prepared for labor and delivery, prepared for postpartum, and offering extra. We are here to support families, support fathers. And what was the third part of the question? I'm so sorry.
You've done great. We've got the meat of it. I mean,
Okay.
your Empower, Engage, Acknowledge Black Fathers shirt has
Yes.
also been helpful to push out. So I think that's good.
Okay.
We'll come
good.
back.
Oh, can I say one more thing?
Yes.
Because I remember the question now.
Okay.
It was how are we actually impacting families? So with us, we're doing it on both sides. I'm able to directly work with fathers and with the families, but we're also doing technical assistance and training medical professionals in our other community-based organizations on how to better engage black fathers, how to retain relationships with black fathers, and how to incorporate fathers throughout the entire process of them dealing with the families. They're already serving the families. A lot of things are geared towards women, children, and families, as it should be, but we cannot forget the entirety of the family, as everything that we speak about is building up the village, including the village. The father is a very important part of that village, so we're also working on that side also with our professionals.
Thank you, Davion.
Very welcome.
You know, I always say the key is we're not getting pregnant by ourselves. That is the key. I mean, even if we have insemination, it's not by ourselves. So thank you, brothers. Our Shields colleague, you wanna go, and then I'll skip to Lorna. I'm gonna give you the question again. All right. Tell us about your program. How can people get involved, and how do you support birthing families?
Again, Parents as Teachers is of course a home visitation program. We serve our families biweekly to monthly, 0 through 5. We basically have a lot of creative engagement, a lot of child interaction activities. We also do the same screenings as my colleague over here, which are both depression, anxiety, and we also do ASQs, which are the developmental the developmental and social emotional. How they can get involved, honestly, it's just a simple phone call or word of mouth. We have no baseline, which means that anybody that has a child 0 to 5 can participate, even prenatal now. Yay, that's new. What was the last question? I'm sorry.
How do you support birthing families and how they can get involved? Tell us how they can get involved. How they get to you.
When they get to us, me.
Who refers them, or is there a process for referral?
We have a lot of referrals from everybody.
Okay.
WIC, Welcome Baby. We've even had the nurses. I don't know their proper name. I do apologize. But we get
Nurse
referrals from
Family
everywhere.
Partnership.
Yes,
Okay,
yes, them.
okay.
DPH and everywhere.
Okay, perfect. All right, perfect. Lorna, you're up next. You got it. Thank you.
I'm Lorna Leverett. I'm with the AIM Doula program, and what we do is we provide support to Black families prenatally, continuous labor support, and postpartum. We provide education, making birth plans, teaching moms basically how to take care of their baby, breastfeeding, things of that sort. And during the birth, we are there giving continuous labor support, getting them through contractions, with massage, just basically staying there with them, because the medical staff, sometimes they're in and out. They're not there with them the entire time. We're there to support the dad, the family, just with whatever they may need. And postpartumly, we're there to make sure that they are successful breastfeeding, they're successful in whatever their parenting goals may be. We give them all kinds of resources. We are referred through WIC, Shields, their doctors. Most of the time they tell me that their doctors have given them a referral to come see us. And yeah, that's it.
Okay, great. Thank you, Lorna. So I have not forgot our wonderful parents here. So now this time is about you all and your babies. So tell us, and I'll start here with David's mom, then I'll come to Nason's mom, and we'll go on down. What was your experience being supported by Nurse Family Partnership during your birthing process? And is there anything that could be improved?
I must say it was a great experience. Not only were my family felt loved, because I not only have David, but I also have 2 older children. And we were going through a really harsh situation to where I was really depressed. I had an anxiety. I didn't feel like even being around people, but just even being around Lizette. Her positive energy, her loving, just even text messages in the morning, was just a lot for my family and I. And my family knew and felt that we had a support, because even my daughter realized the difference in myself as her mom. She noticed that I was getting up even more with a positive energy, knowing that we have a support system and guidance of guiding us where we needed to go it means a lot. It means a lot to my family.
Excellent. Awesome. Yes, give her a round of applause, Lizette. Tell me your name again.
My name is Irma.
Irma. So Irma, was there anything that could be improved, or would you share the program with others?
I would definitely share the program, and I would love to keep Lizette with our family.
Lizette has been adopted in. Okay, she's a part of your family.
Yes, and I don't think I would want to add anything, or if anything, yeah, I think we should just keep her.
All right. Well, Lizette, you gold stars. Your supervisor here. Yeah, let your supervisor hear it. Okay, perfect. Nason's mother, what's your name?
LaDon.
Okay, LaDon.
Yes.
Tell us about the program, anything that you would change, how's it gone for you and Nason and your family?
There's a lot of support. Oh goodness, where can I say? It's a lot of support. I feel that if there is anything that I'm not sure of, or I can reach out to my parent and partner teacher right here, which she's amazing. She's wonderful. It varies from breastfeeding, or what is this sound he's making, or if I'm not sure or understand exactly, what sounds this mean, because it's been 8 years for me since I've had a baby, so it's pretty much I'm starting all over. So, but I feel as long as you living, you learning, and I just feel really blessed to have her. Woo.
Yeah, it's like that sometimes. We got Kleenex. Yeah, yeah. Don't rush. We here. Yeah.
I just feel really supported by her. Thank you. And then the program itself, I just realized, I'm 38 years old. This time in my life, I really am focused. I really want and willing to have the help, all the help that I need, and giving birth to my son, Nason, at the hospital at Long Beach Memorial. I was introduced to Welcome Baby, and that's how I got in tune with Shields for Family, which is perfect because I remember years ago I was trying to get connected with them years ago, but I didn't meet the qualifications at the time. But thank God all things happen for a reason, and just the support is amazing. And the good thing about it, they're 5 minutes around the corner. So, and she's always available for me. And I definitely would share this with any other family that needed help because we all need help. It's each one teach one. And it takes a village to raise a family as well. And this is my little baby right here. I love him so much and I'm just grateful. Excuse me.
No need. We're grateful to have you here. We're grateful for you to be a part of the village.
Yeah.
We're grateful to welcome you into the entire village.
Thank you.
And let you know about all the programs that we have that you qualify for.
Thank you.
We want to make sure we don't have to have that as an issue that would prohibit you from receiving the resources and services that you need. So thank you for being here.
Thank you for having me.
Sharing. Yes, ma'am. Tell me your name again.
Elise.
Elise. All right. Tell us, how has it been with the AIM Community Doula program?
It's been a really good experience for me. She was very good helping me through labor. Like from the moment I called her to telling me to count my contractions to actually physically being there with me. This was my first baby, so I really had no clue what to expect, and she was really knowledgeable about what I should be expecting. And just her physically being there with me during labor, I think throughout the whole journey, that was the most impactful part for me because I was really scared of labor. It's like, the baby's in there, and it's like, oh my God, I gotta come out somehow. So I was like, even when I started the contractions, I was in disbelief that it was like, oh my God, this really gotta happen. So she was really patient with me because I think I was in denial that I actually had to go give birth. So I'd probably text her every day in the 9 days that my baby was here to just tell her thank you because I just couldn't imagine. I literally can't picture labor without her there. Like, I just can't. She was so impactful. Like she said, when the nurses and the doctors are not there, she was still there. And mine started at 11:30 at night, and she got up and still came. So she probably didn't have to do that, but she did go that extra mile to, come and keep checking in with me, then stay. So I really am thankful for her because I don't think I would have been able to do it without her.
That's beautiful. I love it.
Call her name during labor.
Okay, all right, Lorna.
Yeah, so.
That's the life of a doula. Thank you for sharing that. Would you share the program with others?
I've told so many people, throughout my pregnancy, especially now after experiencing the support through labor, like, okay, you're probably going to need this. Moms with difficult situations, that to have someone available to you, even if the father is there or the father is not there, to have someone like Lorna available to you is really a good addition to pregnancy.
Amen. I'm glad you had Lorna, because had you had me as your doula, I'd be like, we have her on virtual because she's 9 days and I need, 6 weeks.
Well, she showed up for me, so I wanted to show up for her.
No, that's beautiful. Thank you for that so much. Yes. Introduce yourself, young king.
How you doing, Dominique? How's everybody doing?
after you.
Dominique. You need the questions again?
I got it.
Y'all
I
watch
think.
how my voice, y'all watch how my voice changed. Thank you, Dominique.
The program for me overall was really life-changing in the sense that as a man, I know my experience is different, of course. As a man, I was trying to figure out my place and my role as far as supporting my wife through the process, and what did she need from me most. And so we're so used to being the strong, independent person and not really relying on anybody to help, right? So getting in the group amongst other men who have been through it or who are going through it was good for us to bounce ideas off of each other and bounce being vulnerable with one another, because I found myself stepping back a lot of the time at first and being like, hey, this is your journey. I'm just here to support you, instead of taking more of an active role. And I found that taking that active role while still supporting was a possibility, right? So when we would go to doctor's appointments and things, what I learned from the class is, hey, I can be active here. Maybe my wife isn't in the position where she even wants to talk about any of this. So now I step up and ask the questions for her. Or if we have that dialogue before and now I'm at the doc, I can be the bad guy to a sense to the doctor. Hey, how are you supporting my wife? How are you doing these things? Because we know the numbers. My wife is very active, very strong in figuring out like, hey, black women go through a lot of death and the babies aren't born. So now I'm facing it head on with the doctors. What are you doing and how are you advocating for my wife? Right? When she says she's in pain, what's your next step? And I learned that through the class and talking with my cohorts and talking to Davion and, hey, how can I really step up here and be that rock that she needs in this process? And then transitioning from there, now how do I step up and be Mr. Dad? Baby steps. But yeah, through the class overall, as you can see, I was very excited about the class and just having a fellowship and being around other guys who are going through similar processes. A lot of times in our community are things we don't want to talk about. You would think that the dad isn't involved or not there. But really, we want to be involved, and sometimes it just takes us being around each other and being like, hey, this is how you do it, and this is how we can do it together. So that was my experience. I wouldn't improve anything. I thought it was all great. It was just the time to just be with each other was more so what I took. Like the lessons were great, but to sit there, be with other black fathers and have that moment together, I thought that was really what was life-changing about it.
Thank you for sharing that. I assume now at this point, Davion will have a waiting list for the Expectant Fathers group. You see how empowering it is and supportive. Yes, hopefully you will, because folks are going to be like, how can I get my partner,
we trying to start a second group,
my brother, my uncle, my friend into this group before him and his partner give birth. So thank you all for sharing that. Anybody have any last closeout, anything they want to share with us before we close and let everybody move around, mix and mingle, and get to know some of the other organizations? Can we give them all a round of applause, these hard workers at each of the programs? Can we stand up on, yes, thank you, Yolanda. Stand up on your feet and give them some love. Extend some love and grace to them for the journey that they have embarked on as parents in our community. And so we thank you even for your transparency and vulnerability. Don't leave, because we do have a gift for the families. But again, we want to thank you all for sharing with us, and continue on with this journey with us and tell someone about these great programs. Thank you again. All right.